it seemed to me that it was high time that we started to recognize that children that get raised in households where there is drug activity going on, that they are as much a victim as any victim we have in this state. And I'm very pleased that this time I'm going to be given the opportunity to put the last signature on the Drug Endangered Child guidelines that have been instituted throughout the entire state. And I'm going to sign that now, and then that will be the final signature. And I am very proud of that. I'm very proud of the fact that South Carolina has now been accepted into the National Drug Endangered Child Alliance. This program started about 2 years ago when I was asked by the Deputy Attorney General, Jim Cole, to start a program such as this. And what we did was, in this office, was we went to an area where I felt that there was both the need, no higher need than any place else in the South, but both the need and the resources to do a good program. And I wanted to go to a smaller community because it's been my experience in smaller communities you get things done a little bit quicker. To that end, we went to Orangeburg, and I contacted Chief Wendell Davis. Chief Wendell Davis has been a part of this program since the very, very, very beginning. You're going to hear from him in just a moment. There were two organizations that were there in the embryonic stages, both Chief Wendell Davis and the DEA, who's now represented by Ron DeCicchio. He is the new head of DEA, and he is here today. Orangeburg County, under the leadership of Chief Wendell Davis, did two things that were very important. He was the first one to recognize that we needed to make this systemic in the law enforcement agency. And he did that. He was a leader in law enforcement on that. He then was joined by Chief Keel, who recognized it was something we needed to do statewide. So it started in a very organic fashion in Orangeburg, spread throughout the state. We did the first statewide training. People came from all over the state to Orangeburg, and they learned the importance of doing drug endangered child treatment. It seems to me that it just makes sense that if we're going to break the circle of violence, if we're going to break this endemic drug problem, that what we've got to do is start recognizing that these children that didn't get asked to be brought into that environment, that these children that find themselves in this environment are victims, and they need to be afforded the same protections that any victim. At this time, I'd like to turn the podium over to Chief Wendell Davis. Let him make a couple of remarks.
Well, thank you. First of all, I'd like to thank our U.S. Attorney for having the foresight to recognize that our children are victims. In law enforcement, oftentimes we have the job of going out and making arrests through raids in the middle of the night. And during those times, we often run across kids that are 2 years old, 4 years old, 6 years old, 10 years old. And they're in an environment that is not a very productive environment. Unfortunately, we find ourselves unable to find a good alternative for them to go to, oftentimes releasing them to relatives who may be in the same sort of business, per se. So we commend our U.S. Attorney for recognizing that we have victims in our children, and if we do not break the cycle, that they will in turn grow up maybe to be drug dealers themselves. So that's really what the focus is, to try to prevent that. I do want to thank all of Orangeburg County for the support in developing the protocol. We had DSS, we had mental health, we had CASA, we had McCord Center, we had a number of partners that came in to help, and I am real proud of what we've done.